Very pleased to say the Shadow Health and Social Care Minister, Labour's Liz Kendall, is here this morning. Very good morning to you. It is a mile away from your brief, but given what we are hearing about Russian spy ships, what we heard yesterday about Russian cyber attacks on infrastructure, and what we are seeing every day in Ukraine, we really need to be mindful of the risk from Russia, don't we?
We need to remain absolutely vigilant against Russia's activities. As you can see, different sorts of warfare, whether that's more traditional types in Ukraine or new cyber attacks. And we have to also remain vigilant against the cronies of Putin in this country and elsewhere to show them that they cannot profit from this behaviour. That twin-track approach, proper defence and those economic sanctions, is essential for the future.
But there is an awful lot to talk about on your brief this morning, and your party has been spending the week looking at the NHS. Today you've been looking at cancer, and I have to say some of the statistics here are not just deeply concerning, they are abysmal. They are abysmal. Just walk us through what you've discovered.
Well, this is information we've been given by hospitals themselves. And what we have found is that patients are waiting up to 6 months to even see a specialist doctor once they've been referred by a GP.
These are urgent referrals as well.
Absolutely. And we know that across the board, more than 500,000 patients had to wait more than 2 weeks. That's the target, to get you seen urgently. More than 500,000 waited more than that last year. We're also seeing patients waiting up to years to actually start and finish their treatments. The target that you should start your treatment within 2 months has not been met since December 2015. So we know that COVID's had an impact, but this is a problem long before. And I mean, I hope that neither you nor your family have ever had this situation, but it is frightening waiting to be diagnosed, and it is frightening waiting to start your treatment, terrified that the cancer has spread. So this is a serious problem which needs a serious plan of action, and we've been talking about that action plan from Labour's perspective today.
It would be remiss of me as a journalist not to say, actually, I have someone very close to me has recently been through this whole process and indeed had to go private because of the lack of provision. So I will state that right now. But what is the solution to it? I mean, of course, oncology is not the only aspect of the health service that has massive waiting lists, but there is the necessity to get treatment as soon as possible if you are to maximise the chances of people actually surviving.
So, first of all, you need the staff, and we have said we'll bring in the biggest ever expansion of the NHS workforce in its history, doubling the number of medical school places, 10,000 more nurses, because you can't get that care without the staff. But secondly, you've also got to have the beds. And we know at the moment that 1 in 7 hospital beds in the NHS have got an elderly patient in them who doesn't need to be there if they got the right care in the community at home. So you need that plan of action. More doctors have the beds that you need to. I would also argue there needs to be real reform there. A lot of people will find they go in and out for lots of different tests, MRI scans and others. And actually what we need to do is bring those teams together, look at the patient pathway, try and get it all so they get your tests done on the same day. Investment, staff and reform. That's the key to getting these waits down.
It may well be the key to getting the waiting times down, but what you're talking about, you know, in terms of capacity within the health service and in terms of social care itself, I mean, we are talking about a decades-long project to sort these things out.
Well, you can make immediate progress. For example, if you can get those elderly people out of hospital, free up those beds.
But that will only come if there is drastic reform in the social care system, more capacity there, better wages for care home workers,
let me just tell you something very simple.
You take my point.
The government has just spent £750 million to try and sort these delayed discharges. As a result of that, there's only a couple of hundred fewer patients in those beds. That's because they didn't get the home care right. So I think that their plan failed to work. We need a different approach. But I would say to you, we do need a long-term plan. I'm not claiming that this would change overnight. But forgive me for reminding of people, back in 1997, We faced a very similar situation when Labour came into government, waits of 18 months or more. And we did actually bring them down to 18 weeks. That is a huge change. It won't happen overnight, but we can start making a difference. The other thing I would just quickly say, because this is something I myself have experienced, is it's so difficult to even get to see your GP to get the referral in the first place. So we've got to get those face-to-face appointments up and running quickly too.
I wonder if we can also turn to that which we're hearing from Suella Braverman. We appear to have stood this up with the Home Office this morning, that judges will be able to, that ministers will be able to direct judges to ignore certain rulings, that they will have the power to deport migrants, and that there will not be the power to stop them through the legal system. What do you make of that? Well,
you will forgive me for saying I will believe this when I see it. Every single claim the government has made about how they're going to stop the boats and get the deportations has not worked. And in fact, the situation has got worse. More people coming over, more money being spent on hotels and accommodation, backlogs growing. What I think is happening here is the government is very good at getting the headlines. It's not good at delivering the plan and the action we need to get this sorted out.
OK, but why then has Sir Keir Starmer not made stopping small boats one of his 5 priorities?
He's been absolutely clear we've got to sort this problem out. We've said that we need to sort out the criminal gangs, speed up the applications process, make sure there's safe routes for people who are genuinely fleeing war, because, you know, the British people do want to see control of our borders, but they are also fair and open-minded for people who are really suffering and fleeing war. That's what we need to do.
Completely, but you also understand why the British public might not be entirely sanguine with, for example, convicted murderers, convicted sexual offenders remaining in this country because it is judged that the place to which they would be returned would be too dangerous for them.
I mean, I'm absolutely clear that the criminal justice system has been broken under this Conservative government. You talk about those sorts of crimes. Why is it that only 2 of every 100 rapes is even charged? Why is it 346 days
I understand that, but I'll
rapes?
repeat the point. The British public are not happy with the fact that people who have been convicted of offences as serious as rape and murder are allowed to remain in this country because judges decide that the place to which we want to return them is too dangerous, rather than, of course, that it is too dangerous for the British public for those people to remain in this country.
I want to see all dangerous criminals and people convicted of rape and murder properly dealt with. People who come to this country, but also people who've been born and brought up in this country. The criminal justice system under the Conservatives is broken. We have the longest court waits on record. My own constituents not getting their cases dealt with for absolutely years. That is the result of 13 years of this government. Labour's got a plan to put that right, and I hope at the local elections we'll get the chance to send the message to this government.
We will soon find out, won't we? Liz Kendall, good to see you.